It's clearly been identified that we need to be moving into new models of care so that we're responding to the needs of the patients and South Australians. And as part of that, it's been identified that there hasn't been enough allied health. And when you're talking about a multidisciplinary team with doctors, nurses and allied health, you have to get that correct.
One of the first steps was to engage the International Centre of Allied Health Evidence and look at research available to show what are the benefits of having allied health across a 7-day service and how does that impact on patient outcomes and the healthcare system as a whole.
So we looked at everything we could possibly find that had been written in the last 20 years, and there was enough literature from around the world on the effectiveness of 7-day-a-week services for us to be able to make a judgment call that there was a value to be had in providing services every day rather than just 5 days in the week.
The decision was to focus on 3 specific clinical areas: orthogeriatrics, so management of hip fractures and other fractures in older people, stroke, and the third area was rehabilitation. If you haven't got a physiotherapist available over the weekend, someone might not get an assessment of their transferability and mobility, so they end up lying in bed for 2 days, which can lead to consequences in terms of loss of muscle strength, loss of mobility, loss of balance function. If someone comes into hospital, for instance, a stroke, and they do a nursing or a medical staff member does a swallowing screen and they felt unsafe to swallow, if you don't have a speech therapist available for 2 or 3 days, then it means people aren't getting food, they're not drinking, they're not getting their medications. Not getting nutrition for a couple of days can again slow recovery and have adverse outcomes. So there were a lot of areas where in some places were being achieved but not uniformly across the system.
The Allied Health 7-day service recommendations have shown that across the orthogeriatric, rehab and stroke areas of care, there needs to be 7-day access to physiotherapy, occupational therapy, speech pathology, social work and dietetics. 2 of the professions, podiatry and psychology, it's recommended that there needs to be access to those services 5 days a week, as currently there's not necessarily those services available at every site Monday to Friday.
It'll either be implemented through an on-site model where you'll have allied health staff working 7-day shifts across the system, or for some of the smaller sites where the activity might not be as high, you might look at an on-call model.
I'd had spinal surgery not so long before, and I had it in a private hospital, and I was very impressed with the amount of help that I got from the physiotherapist from day one. And the fact that I had that service there for 7 days a week helped speed my recovery.
The benefits for the patient is that they receive the intervention that they should be receiving. The patient flow will improve because we'll move people quicker through the healthcare system, and patients will have better sustainable discharge options for when they do go home.
There was a lot of involvement from a really wide range of people across SA Health, and they were nursing, medical, allied health, corporate, finance, workforce people. It was very well attended, as well as some consumer representatives as well.
I think the heart of transforming health is putting the patient first. Patient-centred care is really important. And when you have a committee of health professionals, it's really important for them to have at least one consumer sitting at their table, keeping them mindful that consumers are the centre of the healthcare.